So we get a lot of patients that come in and they have knee pain. It's very common. Obviously, you have two of them and you're putting a lot of weight through them throughout your life. One area that you can get knee pain, and it's fairly common, especially as we age, but sometimes in athletes as well, it's in the back part. So this is a side view of the knee. This is a front view of the knee. So it's going to be in the back part of the knee. Okay, you can, and so again, I'm very adamant about this. You got to find out where the location is, because then you can figure out what to do about it, and you can figure out what's going on, and you can figure out how to fix it. So if you figure out the location of it and you know it's in the back of the knee, a lot of times it's going to be something called like a Baker's cyst. Okay, you have a cyst that can develop, does not have to be surgical. Many times it will just expand or get inflamed, and then it will go down and it'll chill out if you can do the right things. So a lot of times we'll use things like laser. We'll do soft tissue in that area to help to, for us is we're also trying to figure out why. Many times you can get a Baker's cyst because of the muscles below in the calf muscles, the gastroc, or the muscles above, the hamstring. So if these muscles get very, very tight and they start to pull on the tendons, et cetera, you're going to potentially create issues of inflammation in the posterior knee, which could therefore, contribute to a Baker's cyst. And so what we try to do is we try to elongate this tissue, elongate that gastroc, that upper calf muscle, while we're trying to treat that cyst or that inflamed area behind the knee, so that way over time that inflammation will go down. And then also too, if you're correcting the long term or the bigger problem, then you're also preventing this from coming back. So then your cure becomes your prevention down the road. So keep an eye on where the pain where it hurts, where your knee pain is. Find it. If there is some swelling back there, it could be a cyst, but also to figure out the long-term solution. Elongate the tissue above and below, and then try to figure out healthy ways to decrease that inflammation. So that way, and then once it's gone, hopefully you can keep it gone by elongating that tissue above and below.